Good day, good morning, good afternoon, good everywhere you are. And thanks for coming today. My name is Chuck Gillespie. I'm the National Wellness Institute CEO. Looking forward to this conversation. Real quick, wanted to showcase something that National Wellness Institute just recently released, and it is our National Wellness Institute Wellness Promotion Competency Model. This has been a research project that we have been doing for the last year based on our 2017 development of our original wellness promotion competency model. We revised it here with the research that we did in 2020 alongside of Butler University. We had a wonderful group of researchers that were really led by statisticians, professors of wellness management, as well as some great practitioners that really led the efforts in trying to develop these 5 domains. And within these 5 domains, there are 27 competencies. And this competency model really allows us to kind of look at how we need to look at the wellness profession in general and making sure that people are doing what they need to do. And as you can see, you're looking at a communication and connection conversation, legal and ethical principles, authenticity and self-awareness, inclusive and responsive practice, and whole person and systems approach. What these competency models are going to be doing as well for us is it's going to lead us to add an additional revision to our Certified Wellness Practitioner credential, which will hopefully be coming out 1st of August. My suggestion is if you're eligible to be a CWP now, go ahead and get it, because it's going to be a little bit tougher to get with the new model. And that's not a bad thing, because we've got to evolve. And if we don't continue to evolve, a lot of things are going. So with that, I'm going to turn off the share button so that we can all just kind of see each other a little bit. And looking forward to our conversation with Rick Hecht. Rick, tell us a little bit about yourself.
Hi, well, thank you for having me here. I actually got certified through National Wellness Institute, 6 or 7 years ago. I ran the workforce health consulting practice for Kaiser Permanente for about 8 years here in Southern California. And so got all those certifications, but my background's in mental health. I've been a licensed clinician for 28 years here in Southern California. I've run psychiatric hospitals. I have run clinical operations for a health plan, a behavioral health plan. I've run sales and account management. Currently, I work for Optum Health, part of United Healthcare, where I'm the EAP market leader for them. I was a workforce health consultant. A behavioral health consultant for Willis Towers Watson. So I've done a little bit of everything in this space. It's certainly an interesting time to be in the behavioral health field. Currently trying to finish up my doctorate, 3rd attempt, done it twice, not written a dissertation, hoping to get that paper written this time. And my focus, my dissertation is actually on social connection and loneliness. So very excited to be here with you and chat about the topic a little bit and everything else the last 14 months have brought in the field of mental health.
You know, it's definitely been an area that has definitely finally, sadly, shined a light on some of the issues that many of us that have been in this profession, whether it's been the HR field, wellness field, public health, we've seen it. We just didn't know exactly what to do with it or how to deal with it. And as we always say, we always want something to come out positive from something that's been a little bit in the dark, so to speak. And let's face it, this last year with the pandemic, it was almost a year ago that we started the Reimagining Wellness events simply because of the pandemic and trying to really make sure that we had an opportunity to connect to each other back and forth. Rick, what have you seen from a loneliness, from a social isolation? And let's start right there. Kind of help define what those two things are, because they are
Sure.
different.
Yeah, they are different, similar constructs, but different. So social isolation is more objective. So you can count how many friends do I have, how many people are around me at work, in a house, wherever. And if there's nobody, that's social isolation. Doesn't mean you feel lonely. Some of us can feel very connected when we're not around other people. You have 1 or 2 really good, close, authentic friends. Loneliness, it's more a subjective feeling of being alone, even when you're around people. So if you've ever been to a party, surrounded by people, or even at work, one of the things that I study is loneliness at work. And people say, how can you feel lonely at work when you're around people in the old days, when you're around people all day long? And the answer is the opposite of loneliness is not togetherness. It's about really connecting with someone on a different level.
You know, and again, when we talk about it from, I'll say it this way, from a health risk perspective, what are we really dealing with at work, in our communities, with our friends, with our, well, I guess in that case, we may not have friends, but what are those health factors that we really are needing to kind of focus in on?
Well, so both social isolation and loneliness are bad for your health, because people who live alone have increased health risks as well. But what loneliness does, so loneliness evolved in us over time. It was sort of, it's an aversive signal that says reconnect with the tribe. We evolved in tribes. We learned to work in packs. And when you separated from that tribe, good chance you were going to be eaten by something or somehow harmed and not return to the tribe, thus making the tribe weaker, but also preventing you from continuing to pass on your genes. So over time, we developed this signal that said, hey, pay attention to this. This is important. You need to reconnect. And so it was a warning signal that we might be at risk. It set off our fight or flight, our stress response. And it created all that same response that you get when you sense danger. So today, when we feel loneliness, you know, it kind of doesn't serve us quite the same today. But when we feel lonely, it triggers that stress response. So your body fills with cortisol, with adrenaline. Over time, that starts to break down your body. And there's been a lot of research that showed the health risk from loneliness, so the impact on your morbidity and your mortality, is the same as smoking 15 cigarettes a day. So significantly increases your risk of premature death, increases your risk of dementia, heart disease, stroke, everything that comes along with it, any increased stress response. But even your susceptibility to COVID goes up from loneliness, because that stress response weakens your immune system.
And Rick, in thinking about it from even that perspective, you were talking about a lot of the social isolation leads to probably poor health habits and issues like that. And we've seen the numbers. I mean, addictions is a great example of a number that we're seeing has gone up substantially. Talk a little bit about what you're seeing as far as the numbers are concerned.
Yeah, that's one of the really troubling things. So it's understandable why we're all feeling a little bit off, we'll say, and trying to find ways. We all bind our anxiety differently. It could be, for me, it was going to the donut store and eating donuts when I was stressed. Everybody does something different. Generally, it's something a little more maladaptive than something healthy. But a lot of people did turn to drugs and alcohol. We saw around 1 in 3 people start using alcohol to help kind of manage their stress. 3/4 of those people said they increased their drinking by 1 day. So if you drank 3 days a month, 3/4 of us now drank 4 days a month. By itself, not too disturbing, but we've seen other signs. 30% of people report that they have used drugs or alcohol during a work day in the last 12 months. The most troubling for me is something we saw around the overdose epidemic that we've been battling for many years. We actually had started to see it decline a few years back, where we actually dipped under 70,000 overdose deaths in a given year. It trended back up in 2019, and then it really accelerated with the advent of COVID. But last month, some data came out that showed we just broke another record for the most overdose deaths in the 12-month rolling period, 88,000 deaths. So we were at 70 before pandemic. We're at 88,000 expected. When the final data comes in for 2020, will be over 90,000 overdose deaths. And it hasn't just been opioids. We've seen a huge increase in the number of methamphetamine overdoses and cocaine overdoses as well.
And that's where it gets scary. And we start to understand, especially as, I'll say it this way, we return to society, we return to work. You know, some states have gone, you know, all in and said, woohoo, let's just take off the masks and let's get going. Other states are definitely taking a much more cautious approach. Not sure which is right, which is wrong. That's not for us to make that decision. We can all judge each other on that conversation down the road. But when we think about it from that societal thing, Rick, you and I have talked about this in the past, and that is this idea of we're still going to have those folks that are going to be scared to death about coming out into society. But we've still got these folks that are, you know, like I said, I jokingly say, ready to take their masks off, give you hugs, smooches, the whole, you know, the whole world. But we also got to make sure that, especially from a work perspective, those two folks have got to work together in some way.
Yeah.
What are some ideas? What are some best practices, Rick, that you're seeing to kind of help curb that or help kind of bring that together? Because to me, I know it's funny from my perspective, even in society, it's kind of, you walk up and you kind of, you know, it's like, what do you do? Do you kind
pull
of
back,
do a little bit of a, you know, maybe a little bit of a dance, an icky shuffle? Yeah, I don't know. But the point you look at is, you know, this return to society, this return to work, you know, as the head of EAP, you're going to be busy.
Yeah, we're trying to engage managers, especially around some of the things that they can expect. But you're very right, Chuck. So I think it's on a continuum of wanting to jump back in and wanting to hide under your bed for a little longer, especially as people return to work. What they're going to be bringing with them is 14 months of trauma, of fear. We've lost a lot of the social muscle that we had. So there are certain relationships that we have at work that we're going to need to rebuild. You know, when we go back into the offices, people are going to be excited to see each other again. They're going to want to go up and hug, but to your point, they're going to also pull back a little bit. But during the day, when things start to catch up with them and the trauma starts to really come out, people are gonna break down during the day. And you know, our old inclination, of course, was to go up and hug somebody, and now that's something that we have to relearn. You know, when you look at relationships, the type of relationships that work, so you have collegial relationships, like learning to work together with somebody, either in a meeting or sitting down with somebody and really trying to work through something, because we've done so much on our own for so long. You have the water cooler relationship. So the way that information gets spread, kind of your casual peripheral relationships, we're going to have to rebuild those at work too. Just saying hi to people, not leaning away from people, but being proactive about those relationships. For a lot of people, and when we talk about loneliness and isolation, it's those authentic relationships that matter. For a lot of people, those authentic friendships, relationships that they had at work. And so you're gonna have to come back in and reestablish those. You know, you've heard the like the work husband or the work wife that you have, reconnecting with those people on that deeper level. It's gonna be tough for a lot of people. I haven't seen best practices yet. When I present to groups and talk about return to work, a lot of things I talk about is being aware that people are coming back distressed, making sure that people know it's okay to not be okay, helping people ease back in, you know, to a lot of things. Like you can't day drink anymore if you're one of those 30%. You got to start wearing pants when you're working, but also just building those relationships in general with people. So it's going to be a transition, but it is going to take some relearning as well.
Absolutely. And Maureen even said in the chat, her HR person said, we are not coming back the same people.
So true. You know, one of the things that drives my thinking around this whole return to work is years ago, I had a woman who worked for me, a very strong, resilient woman. But her husband served many tours of duty in Iraq and Afghanistan. And right before, like 2 weeks before he would come back from a tour of duty every time, she would be sitting at her desk shaking and crying and very emotional. Again, someone who was normally very strong and resilient. And I would ask her, you know, what's going on? What's kind of driving this anxiety? And she said, he's been gone 6 months. I don't know who he is anymore. And this is someone who was married to a person. And every time that same sort of behavior manifest when he was coming back. And that's sort of shaped how I think about us going back to work. We've stayed connected to people. You know, I started at Rally or Optum, returned to them in June. I've never met any of these people that I've been working with for the last 8 months or so, 9 months. I see them online every day. I trade 1,000 emails with them. I've never met them. I don't know who they really are. And for a lot of us, that's what we're going back to. And also the level of trauma that your coworkers have been through. You know, we've all been fighting a war for 14 months.
In a lot of ways. You know, Edna had a great question here. How open are people to sharing with EAPs and with employees regarding mental health issues? And I'll say this, Rick. My last stint as an HR leader was back in 2008, 2009 timeframe. And I can still remember saying something like to an employee that needed it. I was like, well, we have an EAP. And back then the reply was, I ain't crazy.
Yeah.
I know that has absolutely changed in the last 10 or 12 years, but kind of
not as much as you would hope. Yeah. So we've certainly made some progress on stigma. So about somewhere around 93% of companies have an EAP. When you survey employees, about half of them say, no, we don't have an EAP. A lot of people don't know what it is. EAPs are a little less stigmatized than just mental health because they cover legal, financial, work life, child care, elder care referrals, all of those things. But there's still a lot of stigma. About 1 in 4 adults in the US deals with either a mental health issue or a substance use issue in a given year. And only about maybe 2 in 5 of those actually get help. And there are a bunch of reasons that people don't access care, but stigma is certainly one of the most driving reasons that people don't get care. In a survey, it was around 2/3 of people say they wouldn't be willing to share any information about their mental health distress with an employer. So they're worried it'll cost them their job or it'll impact a promotion. So we continue to make strides, and there are a lot of great efforts underway at several workplaces to kind of smash stigma, but still a big issue.
You know, and it's interesting, Rick, because one of the comments that you just made there was really thinking about those trust issues. I think the word's going to be used here. And I'm updating our worksite wellness specialist on-demand training program right now. And one of the statistics that just recently popped up was something like 38% of your population believe, 38%. So it's the opposite, 72%. 72% of the people in your workplace believe that your personal health data is not being used correctly, or it's being unsafe or unregarded. And that is a scary number if you really start to think about the level of trust that we have got to create, particularly when it comes to things like mental health.
Sure.
I know you guys are dealing with this, and again, as we're talking about, when people are coming back, they're not going to be the same.
Yeah.
What are we anticipating? What does EAP look like next 6 months, the next 3 years?
Yeah. So health data, and this varies, as does mental health stigma by generation. So the millennials, the Gen Zs, who are the loneliest generations, by the way, and have the highest incidence of mental health distress, especially during pandemic, aren't quite as stigmatized, a little more open to sharing and trying to get help. But health data has so much value in the hands of the right people. It allows organizations to be proactive and help get ahead of physical and mental health conditions. But a lot of us still feel very paranoid about employers getting a hold of that data and how that impacts us, or everything's out on the internet these days as well. I think it's important for employers to really promote anti-stigma messaging as people come back to work, and make sure they say it's okay not to be okay as often as they can, and teach managers to reach out. There's a training that I'm facilitating for a number of our customers called my 3R training, but it teaches managers to recognize, respond, and refer to people with mental health distress. Most managers don't have that skill set, admittedly, when they're surveyed. It's just a matter of helping them recognize that people are coming back impaired and being empathic, really approaching people in a caring way, and then saying, we have these great benefits. We have digital tools, we have an EAP, we have behavioral health. Mental health distress, well, mental health exists on a continuum. So emotional well-being to acute mental health distress and everything in between. And there are solutions for that. Not everyone needs to go see a therapist by any means. So I think promoting EAP, but promoting all of the services that you have, whether it's financial help, because people are certainly coming back with financial issues from the events of the last 14 months. As far as EAPs, one of the interesting things we saw, I was still a consultant when the pandemic hit. And around May, the end of May, I surveyed the top 10 EAP companies. And I said, wow, how are you guys handling the call volume? It must be through the roof. And to a group, they said, no, it's actually down about 30%. And when I looked into it a little further, people were interested in, getting enough toilet paper and Oreo cookies and all the essential things in life, not thinking about their mental health. And I think as we come out of this cloud and people start getting in touch with that, I think we're going to see utilization really take off, which is a good thing.
Yep, and I agree with you, Rick. And again, these were conversations. It was funny because it would have been March of last year. I remember reaching out to then U.S. Surgeon General Jerome Adams, who happens to be a friend of mine, because he's here in Indiana. We worked together before he was the Surgeon General. And the reply that he gave me after I texted him and said, hey, what can National Wellness Institute do to help? His reply was his biggest concern is what's going to happen after the pandemic. And even a year ago, he was already thinking that way. We got together about 3 or 4 weeks ago here in town in Indy. And I told him about my text that I've kept from him. And he looks at me and he goes, that hasn't changed. He is still more concerned about what he's calling the wellness pandemic that's coming at us, that next wave. We lost 500,000 people. We're going to lose more from the health pandemic. But he, like you said, 88,000, 90,000 due to some sort of an addictions death. The suicide rates are probably, you and I talked about that.
Yeah, they're actually
numbers
down
are, but they're going to be
today.
coming.
Yeah, but they're coming. And again, as a lot of people come out of this, or as we all come out of this, we're going to see an increase in the incidence of mental health, which is also going to significantly impact what we see from a physical health standpoint. So we know that a lot of people that were involved in their worksite wellness programs, and part of what kept them walking their steps and doing everything have stopped. A lot of self-care, a lot of doctor's appointments, a lot of things that we normally did to manage our physical health have gone by the wayside. We know mental health is sort of this percolating, this brewing epidemic that's coming too. But while we didn't address it, again, your stress response, your autonomic nervous system has been in overdrive. And all of that cortisol, adrenaline, inflammation, everything that comes with that response is wreaking havoc on our bodies and our physical health. And the co-occurring incidence of mental health and especially chronic conditions, it's very high anyway, anywhere from 30 to 40%. We know they go hand in hand. So I think we're going to see a lot of increased mental health use, a lot of symptomatology, and then a lot of physical issues that come along with that.
So, Rick, what are some things that wellness champions, HR professionals, community health leaders, public health folks, government affairs folks, you name it, what are some things that we can do now that can hopefully prevent some of the things that we know are coming? And I'm actually going to jump in here also. Valerie just put in some things here. I'm sorry, Jesse, Can you share where I can locate the overdose death rate numbers?
Definitely.
So,
Um,
but think
yeah,
about it from that perspective. Let's face it, we're already in a reactive mode right now because it's already
yeah,
here, but let's be as proactive as reactively possible.
yes.
Did I just come up with, yeah, I think that's exactly what I
Look
want
at
to
that.
say.
You're going to coin that
I'm going
with
to,
your icky
that is
shuffle.
trademarked,
Perfect.
everybody. So,
Okay.
you owe me royalties if you use it.
Um, for those of you that have a network of well-being champions, if emotional well-being isn't part of what they do, either create a new group of mental health champions or really arm your well-being champions. And if there's ever an opportunity to do a training for you, Chuck, or anywhere to kind of give some tips on doing that and communicating that, I'd be happy to come back. And then one of the things, so next month, we're in April still, right? Okay. May
Yeah.
is Mental Health Awareness Month. In reality, every month should be Mental Health
Yes.
Awareness Month. But look at the way you communicate well-being, and in every communication you do, now more than ever, as people come back to work, you need to be communicating mental health. So awareness about mental health issues, about how it manifests, how it might show up at work, that what you are feeling, there might be some help for. And then all the resources that are available to your organization, but it should be in front of people all the time. Back when I ran the well-being practice, the consulting practice, the thing I should say is wellness isn't about eating better or moving more or not smoking. We all know that, right? We already know those things. We didn't miss the memo, but stress and depression make us make bad choices. So if you don't take care of emotional well-being, you're really going to struggle ever being able to take care of physical well-being.
Amen to that. And again, we've really tried to reduce the ease of understanding exactly what wellness should be. And we define it with 5 words, and that's functioning optimally within your environment. And when you think about it, those are the things that we have to really think about. And those functioning optimally is not just a physical only perspective. That's a mental health, it's spiritual health, it's environmental. And when we think about the environment, it's not just making sure that it's safe. It's a safe place to work. It's a safe place to live. But it's also those, I'll say it this way, those relationships, going back to the social isolation and loneliness, talking about the fact that, there are going to be a lot of people that don't want to go back to work because they've been able to eliminate the poison problem that was part of their stressor that was going on at their workplace. These are the kind of things that we're going to have to understand and be much smarter and more proactive as we move forward. But then we've also got to kind of make sure each of us work together to make that happen.
Yeah, no, that's a really great point, Chuck. And when you think about it, so for a lot of people, their true authentic relationships were those at work, right? Those were the people they count on, talk to. But for others, work was the source of making them feel more lonely. So again, back to the loneliness at work piece. So because of the way we evolved, and loneliness led us to become basically tribal. We're tribal by nature. When you are at work and you don't feel connected to people, or you have those personalities at work that make you feel less of a person or less adequate, it has an impact on you as well. So I haven't really been thinking about that much until now, but those people are going to have to show back to work and deal with the negative side of that. I've only been focused on the positive. So thanks for that. Giving me something to noodle on for a little while.
We've just added to your dissertation.
There you go. I think, so when we, one of the most important things that relationships bring us, and if you want to look up a great study, the Harvard longevity study on wellness, you guys probably talk about it in your practice there. For years, been studying people for 80 years and, what constitutes behavior that leads to health. A lot of great research on exercise and diet and health. But a few years ago, they came out with what they said was the single most important finding, which was that good relationships are more important to your health than anything else. And so that goes back to the authenticity of those relationships. And when I was in my 20s, 1 in 10 people said they didn't have a confidant. They didn't have that one person to go to if they had a bad day at work, their dog died, they broke up with a girlfriend, whatever it was. 1 in 10. Today, 4 in 10 people don't have that. And that stress that's caused by that, and those people that sit at work surrounded by everyone having a good time, that feel disconnected, that no one knows them, it's doing such damage to them physically and mentally, that we need to find ways to really make people feel included, to feel part of that team. And it really starts, just like physical well-being, really starts with that manager creating a space where people feel cared for, as a person, not just an employee, that the manager knows them. It's more important now than ever before.
It's so true. And Rick, if I recall, that the Harvard longevity study, when they came out with the idea that socialize, that having friends is as critical of a factor of longevity as the other, I want to say that they actually said that it's actually a bigger function of your longevity once you reach the age of 40. And I want to say, there was an age period of time where 40, once you hit 40 years old, when you lose your eyesight for reading, once you get your reading glasses, you better start looking for friends, because, that's kind of the same time frame. My wife's an optometrist. So, and by the way, these are reading glasses.
Sure.
But the point you look at is, I think that's such an interesting dynamic, because once you reach that age, then it's a matter of where are those friends and how do those connections start to happen. And I just love that philosophy, because it just goes back to, we've heard the famous lines from our politicians, follow the science. Well, this is science. This is actual science that's showing exactly what we need to be thinking about. So how do we start to create communities of relationships, communities of care, and build these centers and these places. And it's something that we're going to be taking on more and more here at National Wellness Institute, as we've taken over the Healthy Places initiative from the Project for Public Spaces.
Fantastic. Yeah. Oh, that's fantastic. I think this study, it's been a while since I read it. I think it said that by judging the quality of your relationship at 50, they could determine your longevity, basically. And people who felt lonely, and a lot of them in the studies around loneliness, about half of people that say they're lonely are married or in a relationship, which speaks again to quality versus quantity. But people who were in bad relationships at 50 had really poor outcomes. People that were lonely had bad outcomes. People who were in good relationships had the longest, healthiest lives. If you look at the Blue Zone work too, and the key factors. So togetherness, that sense of community, is a key driver for them as well, that sense of community. A great place for us to really impact that is at work, is creating that sense of tribe, that togetherness. If you think about your own workplaces, when we're at work, and what do you really know about the people that you walk by every day in the hallways? What do you know about the struggles that they're dealing with every day? It brings in social factors. So those social determinants of health, that you don't know what they're struggling with. You think they come in, they're just an angry, upset person, but you don't know what happened right before they got to work. And we don't take the time to know that. So having superficial relationships doesn't solve the problem. It's getting to know people at work, and getting to know the employees on your team who you count on to make you look good and successful, knowing them as a person, understanding the struggles they have, understanding how they show up as a brother, sister, father, mother, friend, neighbor, whatever, not just a coworker, goes a long ways towards making people feel connected. Gallup did some work a few years back that showed that people who have a very close friend at work, which is about 30% of people, are much healthier, much more engaged at work, have better health habits, produce higher end results, better with customers, on and on and on. Fostering that connection as best you can at the workplace can go a long way.
Well, yeah, and Gallup has such great data on that. Their Q12 that they've been doing for decades now. I have a best friend at work is one of the 12 questions that they ask. And And thanks for saying that, Rick, because actually John Clifton, who is the global head of global managing partner for Gallup, and also the grandson of the founder of Gallup, is going to be one of our keynote speakers at our conference this year. So, and John's a great guy. We have a lot of great conversations, and it really is looking at that. And in fact, his dad, Jim Clifton, the CEO and chairman of the board right now, he did his groundbreaking work on great jobs. What constitutes a great job, and it's having that purpose in what you're doing, and having that connection to your company, and having that ability to do those things, and by adding these things. And oh, by the way, it's not that you're making a lot of money, but you are making enough to live on.
That's right.
That's what constitutes great jobs, and what we've got to do is create more of those, and those opportunities are huge. Real quick, Rick, I don't want to miss out, because Edna put this out here a little while ago, and I want to get back to her question real quick. EAP counselors, this is kind of going back to your job. Yeah. Is the duty and loyalty to the employee or the employer? And her interest is mainly in that area of privacy.
Yeah, so different types of EAPs, right? So sometimes organizations have on-site counselors. Generally employed by the vendor, but not always. Some employers, there are several employers that run their own. So our network of 200,000 EAP providers only focused on the member. They don't have any interactions. Us as an organization focused on the member. We're there, we're hired, we're paid for by the employer, but everything is confidential. On site, they're also held to confidentiality standards, but there are times where they are asked to participate in an employee's either fitness for duty, or maybe a manager refer someone, a mandatory referral. They don't share details. That's confidential information, but they do, when it's required for someone to continue to work, they'll provide some information about how they feel that employee is regarding their mental health. If again, almost to a fitness of duty level, but no, they're getting paid maybe by an employer, but their loyalty is kind of a big word, but their commitment is to that employee, that member seeking help.
As a matter of fact, and again, I'll kind of add to that as well, and that is that employers do not get their information back. All they say is, X number of people utilize the service. That's really about all they get. It's not a huge amount of information. And that's simply because of the private health information. Yeah. And PHI is such an important factor. The problem being, again, it goes back to that communication and making sure that you remind your employees over and over and over and over and over and over and over again that, we do not get that information. And they still may not listen to you. Maureen, I love this question. I wonder about peer support groups with organizations. Of course, trust needs to be in place, and the success of this dependent on number of factors, buy-in, ability to organize, etc. Do you have any suggestions or knowledge to share?
Yeah, thanks for that question too. So one of the things that I'm really encouraging employers to look at is to create employee resource groups around mental health issues. It can be stress, anxiety, loneliness, or just general mental health, to allow people to come in and start to share common challenges. There are also a number of online platforms that allow you to join communities that are peer-based support. We are partnering with one to build into our EAP called Supportive, but there are several other organizations out there where you can go in and find groups to provide peer-to-peer support. There's value to that. I think creating them at work, again, you have to overcome the stigma issues, but it also helps people feel connected at work a little bit. So I think it can solve some of that social isolation and loneliness that goes on at work too. Great question though.
It was. And you know what? This is actually a great question that was asked before Maureen's, but I liked it because I thought it would be a better transition back to this. And that is, how can we help people in communities outside of work where they don't know that they have or they don't have an EAP type of connections?
Yeah, I guess it depends on how you have access to them. If you talk about, friends and family, because let's face it, most of us are struggling some level of mental health distress. So I think if there are people that you know, again, connections, close connections, that you can check in and say, hey, I'm worried about your, what's going on. You seem a little bit off, maybe not quite depressed, but just not quite yourself. And you want to refer them to treatment. If they're employed, the odds are they have an EAP. So ask them to check with their employer, or offer to help them check and see what resources. There's also a lot of community resources out there. There's a great tool called Google that allows you to pretty much find anything. But again, if they're employed today, I would start there.
Yep. One of the things, Rick, that we've seen, and again, the research that we've been doing over the last 2 years, and in fact, it's research that I've been doing for about 15. Yeah, Google's there, but it's not necessarily, now we're asking people to actually try to figure out something on their own that they may not even know what to ask for. And I'm going to lie. It actually leads to exactly the initiative that we launched in January of 2021. And of course, I'm going to tout it, called WellFinder.
Wow.
And the whole idea here is, how do we have that engine, that wellness engine, that person, that group, that organization, to community better? How do we make this happen? And how do we deliver it through, our 6 dimensions of wellness? And I thought I had the engine on here, but it really is thinking about making sure that there is at least somebody or a community or a group. As a matter of fact, I'm working, and granted, we're traditionally going to be looking at underserved communities for this.
Mm-hmm.
But it's always good to learn from, communities that are already doing it. And traditionally speaking, those are going to be more affluent communities. Now, I couldn't pick a more affluent community than, say, Naples and Marco Island, but they are doing some tremendous work with the Immokalee population in the Collier County area of South Florida, which if you know about Naples and Marco Island, you know that there's like 6 billionaires that live next to each other there. But then you've got Immokalee that's only 20 miles away, and it is one of the poorest parts of the entire country. So they're really trying to figure out how to bring some of those key resources in. And we've learned a lot from modeling them on how to build the WellFinder initiative. So I'm really excited about what this is going to be coming. And we're really building this out with the idea of, how do we make sure that people can get those resources and we don't have to rely on just Google, or let's face it, 211 is a nice little idea, but it's not, again, they're basically just on the backside Googling the same time. So, so we're really looking at WellFinder as hopefully part of that answer to the question. So
that's great. And is that available to anybody?
It will be. We're actually in the process of fundraising right now, and looking for those opportunities. But we've got 3 communities that we're working with. And I'm actually reached out right now. We're in the process of working with the CDC Foundation, Dr. Judy Monroe, who actually is also one of our keynote speakers for the conference this year. And Judy and I have been conversing about trying to get at least the start of some research done. So we have our Healthy Places audit, we have our multicultural competency audit, and we have our wellness inventory that we can start to package together and build out kind of at least a state by state or a country by country analysis of those 3 pieces, so that we have a baseline starter point, and then we can start to build off of that and really try to build this engine out. We're getting closer, but we're hoping to have it really fully operational soon.
Sounds great. I definitely want to hear more about that. That's something that I think would be valuable for me to be able to share with people too. I want to address Tracy's question there, because it's such a good one too. Is a lot of people lost jobs. We're not just dealing with the health pandemic, we're dealing with a financial breakdown. We had highest unemployment since the financial crisis. So a lot of people who lost jobs and benefits have financial stress, probably significantly dealing with mental health issues as well, and substance issues. So I can't give you a list of them right now, but I'll send Chuck something that he can distribute with some resources available too. But it's a really great call out. So my answer was very short-sighted in that, tell them to check with their employer about their EAP. But for people that don't have that, there's still a lot of great community resources, free tools and resources that are available. I saw someone put in there about Mental Health America and some resources they have too. So I will get Chuck a list to distribute with some other options.
That'd be great. And I added in there, PricewaterhouseCoopers does a annual financial wellness survey each year, and they just send out their 2020 results, which is very interesting. This is the first year that Kent Allison from PricewaterhouseCoopers has not been running this, but Kent is now working with our partner, Foundation for Financial Wellness. And we've got some really good programs too, Tracy, that you might want to take a look at, because what we're really trying to do is really teach people about their relationship with money. And we've got to get out of this mindset of, I'll say it this way, this mindset of retirement and savings. We've really got to get down to the core. I jokingly say it's kind of like couch to 5K. That's not what we need. We need a couch to stand up program. Much like that in financial wellness. We can't go straight to retirement. We actually got to teach people that you can't go to Starbucks 37 times a day and think you're going to save money. So we've got to build that relationship with your money and understand the habits that are going on. So Rick, I'm excited about seeing what you might have and add to our list, because we're always constantly looking for things to be able to add. And I'm excited about that. With that, Rick, thank you so much for your time today. Could not be more excited about it. And I love the conversation we had. Great questions from the team here. And I look forward to many more conversations with you, my friend, and look forward to continuing to have our journey and move it forward.
Likewise, Chuck, thank you so much. And thank you all for joining in. Appreciate it.
Thank you. And by the way, this has been recorded, and it will be available on our website, nationalwellness.org/reimagine. And we will send an email out and let you guys know when it's up. Thank you very much.
Take care. Be well, everyone.